My name is Hannah Howington. I'm the Director of Prosthetics at Premier Surgical Prosthetic Center in Knoxville. We welcome any and all patients with amputation. We specialize in vascular patients because that's what our surgeons here do, but we also get outside referrals from other physicians. We do upper extremity and lower extremity, but the vast majority of our patients are lower limb amputation. Any patient who has amputation who is motivated to use a prosthesis, at least for transfers, is a prosthetic candidate. They don't have to necessarily be very active, although we can obviously provide a prosthesis that would allow them to be more active. We try to look at the patient as a whole. The big indicator of what they're going to be able to do with their prosthesis is what their previous level of function was. So the types of activities that they were doing on a daily basis before their amputation. We also look at how far they've progressed since surgery, how well their limb is healed, and then what their goals are with the prosthesis, what they'd like to get back to, or any new activities they'd like to be able to do with the prosthesis. So the prosthetic process can be kind of lengthy. Starting at the point of amputation, the patient will usually have their staples in for about 6 weeks. There's not much we can do from a prosthetic standpoint while they're in that stage of healing, but we do meet them at the hospital and we offer a consultation and just stay in contact with them to be an emotional support. Once their staples are removed, we fit them with compression garments to control the inflammation and shape their limb for their prosthesis. Once they are healed and they've been shaping in their compression garments for a couple of weeks, we start the fitting process where we measure their limb and take a scan, a 3D picture of their limb to build a prosthesis custom to them. Technology has come a long way with prosthetics. We've integrated a lot more CAD/CAM technology, meaning 3D imaging and manufacturing of the prosthetic socket. It's very customized to the patient. It's also very quick and efficient to fabricate in that manner. And then it's obviously cheaper and quicker, so it cuts down the time between the evaluation and delivery of the prosthesis. The technology is wild. We are able to actually capture the neural pathways and the muscle signals from the brain to control like prosthetic hands. And then we have microprocessor knees and feet that constantly adjust to the ground as the patient walks to keep up with them and just provide a more natural gait and a safer gait. Most insurance plans do cover prosthetics. That doesn't necessarily mean that they'll be covered at 100%. A lot of times insurance will only cover about 80%, and if they have a secondary insurance, then they may pick up the rest. Our main goal is to take care of the patient. We want everybody to be able to walk with a prosthesis, and we're going to make that happen. There's a multidisciplinary approach to treatment here. The surgeon and then the prosthetist are working hand in hand at every step of the way, which really keeps things moving quickly. It helps us get to the end point without as much red tape. My favorite part of the process is building a relationship with our patients, and that's something as a prosthetist that I really get to do more so, I think, than a lot of other areas of medicine, because I see our patients, at a very vulnerable moment in time when they're amputated, and I see them on a weekly basis for months trying to get them, back on their feet, and then over time, I see them throughout their lifetime. And it's just so fulfilling to see a patient roll into the office in a wheelchair and walk out on 2 feet. So it's very emotional and very fulfilling. We have a lot of hard moments with our patients, especially at the beginning in the hospital, and they're really just down and discouraged and worried about what their life is going to look like long term. And it's really nice to be able to be there and be able to offer some support and encouragement that I've seen this hundreds of times, and you can do it just like every other patient can do it. And I don't know, it's really fulfilling to be able to be that support and that encouragement, and it just really builds a relationship that is kind of unlike anything else.